Welcome to your deep dive. Today we're going to be looking at Behçet's disease,
Okay.
which is a rare inflammatory disorder.
Huh.
And you sent us a ton of great sources on this,
Yeah.
like medical texts and treatment overviews, and even some stuff about like natural remedies for Behçet's.
Hmm.
So it sounds like you really want to get a good grasp on like what this disease is, how it shows up, and how it's treated.
Yeah, exactly.
So maybe we can start with like the very basics.
Yeah.
What is Behçet's disease?
Well, it's a fascinating disease because it often presents with like a classic triad of symptoms.
Okay.
So we see these recurrent oral ulcers, genital ulcers, and then inflammation of the eye.
So like canker sores and genital ulcers and eye inflammation all kind of linked together.
Yeah, exactly. Uveitis is the medical term for that eye inflammation.
Okay, so that's a lot to deal with right there.
Definitely.
But it's interesting to me that these seemingly unrelated symptoms, they actually give us clues about what's happening like underneath the surface.
Absolutely. That's a great observation.
Like how are all these things connected?
Well, the presence of this triad points to Behçet's being a systemic inflammatory disorder,
Okay.
meaning that the inflammation is not localized. It affects the whole body and particularly the blood vessels.
That makes sense. So then the big question is like, what is actually causing all this inflammation?
Right.
Like what's going on there?
That's the million-dollar question. The exact cause still remains a bit of a mystery,
Yeah.
but researchers believe that it involves like this really complex interplay between your genetics and then also environmental factors.
Okay, so it's not just one or the other. It's like this combination.
Exactly. And one gene in particular is really strongly associated with Behçet's.
Okay, which one is that?
It's called the HLA-B51 gene.
HLA-B51.
Okay.
And so if you have that gene, are you guaranteed to get Behçet's?
Not necessarily. It just increases your risk.
Okay, so it's like a predisposition.
Right. It's thought that this gene might lead to the production of certain proteins that your immune system kind of misinterprets as foreign invaders.
Oh, so it's like your immune system is attacking your own body.
Exactly. It triggers this immune response against the body's own tissues, which then leads to that inflammation we see in Behçet's.
So it's like the immune system's getting its wires crossed.
Exactly.
And having this gene increases your risk, but it's not a guarantee.
Right. Environmental triggers also play a role in setting off the disease.
Like what kind of environmental triggers?
Infections, stress, even certain medications, they're all potential triggers.
So there's a lot that we still don't know.
Absolutely.
Your sources also mentioned something called the pathergy test.
Yes.
What is that exactly?
It's a simple skin test that can be really helpful in diagnosing Behçet's.
Okay.
What happens is a doctor will just prick the skin with a sterile needle, and in people with Behçet's, this will trigger an exaggerated immune response.
Okay.
So you'll see a small red bump or like a pustule within a day or two.
Oh, wow. So it's like a really clear example of that overactive immune response we're talking about. And so this test, along with, looking at those classic symptoms that helps doctors to differentiate Behçet's from other conditions.
Right.
But it sounds like the symptoms can actually go beyond just those ulcers and the eye inflammation.
Absolutely.
What else should we be aware of?
So yeah, while that triad is often the most prominent feature, Behçet's can affect a lot of different parts of the body.
Okay.
For instance, skin lesions are really common.
Like what kind of skin lesions?
A particular type called erythema nodosum, which causes these painful red nodules, usually on the legs.
Oh, wow.
And it can also cause joint pain,
Oh.
sometimes severe enough to actually limit mobility.
So it's really more than just a few isolated symptoms.
Yeah.
It's like a systemic issue.
Exactly. And we can't forget about the vascular system.
Oh, right. The blood vessels.
Behçet's can cause inflammation of those blood vessels,
Oh.
which is known as vasculitis, and that can lead to a whole range of problems depending on which blood vessels are affected.
Oh, wow.
It can even increase the risk of blood clots.
Okay, so it really underscores the importance of early diagnosis and treatment for this.
Absolutely.
I think this is a good place to pause and pick up in part 2. Okay, so we've been unpacking some pretty heavy stuff about Behçet's disease.
Yeah.
That classic triad of symptoms, the overactive immune response, how it can affect different parts of your body.
Right.
Now let's switch gears a bit and delve into the treatments.
Okay.
I'm really interested in those natural remedies that you mentioned in your sources, like Manuka honey and fasting.
Those are some great examples of how people are exploring complementary approaches to managing Behçet's.
Yeah.
So let's start with Manuka honey,
Right.
which comes from New Zealand and has some unique properties.
Yeah, I was reading about its antimicrobial and anti-inflammatory effects.
Right.
What makes it so different from like the honey I put in my tea?
Well, Manuka honey contains a compound called methylglyoxal, or MgO, and it has this in much higher concentrations than regular honey. And this MgO is what gives Manuka honey its potent antimicrobial and anti-inflammatory powers.
So it's like a supercharged version of regular honey.
Exactly.
So higher MgO means more potent healing properties.
Exactly. And when you're choosing Manuka honey for medicinal purposes,
Okay.
you want to look for a high UMF rating.
UMF, what does that stand for?
It stands for unique Manuka factor.
Okay.
And this rating system measures the MgO content and other key properties.
So higher UMF means it's more potent.
Exactly. A UMF of 10 plus or higher is generally recommended for therapeutic use.
That's helpful to know.
Yeah.
We've talked about applying Manuka honey directly to ulcers for healing. But are there other ways it can be used for Behçet's?
Researchers are exploring a range of applications for sure.
Okay.
Some studies are looking at incorporating Manuka honey into oral rinses or even creating like specialized dressings that are infused with the honey
Oh, wow.
for treating skin lesions. So
It's like nature's own bandage.
exactly. It's really exciting to see how this ancient remedy is being explored with modern scientific methods.
Now let's talk about fasting.
Okay.
I have to admit, I'm still trying to wrap my head around how not eating could be beneficial for a condition like this.
I understand it might seem counterintuitive,
Right.
but research suggests that fasting can have a profound impact on the immune system and inflammation.
Okay, I'm intrigued. But what's actually going on in the body when we fast?
Well, several things happen. First, fasting reduces the production of those signaling molecules that drive inflammation.
Okay.
Those are called pro-inflammatory cytokines. So it's like calming the storm within.
Okay, so it's reducing the inflammation.
Exactly. And second, it triggers autophagy,
Autophagy.
which is a process where your body breaks down and recycles damaged components.
So like cellular spring cleaning.
Exactly.
I like that.
Yeah.
You mentioned autophagy earlier.
Right.
Can you break down that process for us a little bit more?
Okay.
And explain how enhancing it through fasting might specifically help manage Behçet's.
So autophagy, it's this natural process where your cells essentially clean house,
Okay.
getting rid of old or damaged parts. And it's crucial for just maintaining cellular health and preventing the buildup of harmful substances. And when you fast, it's like you're flipping a switch that ramps up this cleaning process.
Okay.
And this is particularly relevant for Behçet's because it involves the immune system attacking the body's own tissues.
Right.
So by enhancing autophagy, fasting could help clear out those damaged cells.
Okay.
And kind of reduce the triggers for this misguided immune response.
So it's not just about depriving yourself of food.
Right.
There are these intricate processes happening at the cellular level.
Exactly.
It's pretty amazing.
Yeah.
You also mentioned different types of fasting, like intermittent fasting and extended fasting.
Right.
Are they all equally beneficial for Behçet's?
That's a good question.
Yeah.
Intermittent fasting, where you cycle between periods of eating and not eating, is generally considered a safer and more sustainable approach,
Okay.
especially for someone with a chronic condition like Behçet's.
Makes sense.
Extended fasting, which involves going without food for longer periods,
Yeah.
should really only be done under strict medical supervision.
Okay, so something like the 168 method where you eat within an 8-hour window
Exactly.
and fast for 16 hours.
That's one popular approach.
Okay.
But it's crucial to work with a healthcare professional to figure out the best fasting protocol for you,
Right.
taking into account your individual needs and health status.
That makes sense. Safety first, always.
Exactly.
Now, I'm curious how these complementary approaches fit in with conventional medical treatments for Behçet's.
Yeah.
Are they meant to replace medications or work alongside them?
It's important to think of them as complementary approaches.
Okay.
They can potentially enhance the effectiveness of conventional treatments
Okay.
and provide a more holistic approach to managing the disease.
So it's about integrating different modalities for a more well-rounded strategy.
Precisely, someone might continue taking their prescribed medications while incorporating Manuka honey for topical ulcer care
Right.
and adopting an intermittent fasting regimen to help regulate their immune system.
So it sounds like there are many possibilities, and it's about finding the right combination for each individual.
Absolutely. That's where the guidance of a knowledgeable healthcare team is crucial.
Yeah.
They can help you navigate these options, monitor your progress, and adjust the approach as needed.
It's great that we're seeing more integration of these complementary approaches within conventional medicine.
Absolutely.
Speaking of progress, what kind of improvements have people with Behçet's reported after using Manuka honey or fasting?
While more research is needed, anecdotal evidence and some preliminary studies suggest that Manuka honey can significantly reduce the pain and healing time of ulcers.
Wow, that's great.
Yeah, some people even report fewer recurrences with regular use.
That's amazing.
And as for fasting, some small studies have shown promising results in reducing disease activity, including the frequency and severity of flares.
It's exciting to see how these ancient practices are now being backed by modern science.
It really is.
But I imagine there are still potential downsides or challenges to consider.
Of course. With Manuka honey,
Yeah.
it's important to be aware of potential allergies.
Right.
And as we've discussed, fasting isn't right for everyone.
Right.
People with certain medical conditions, pregnant or breastfeeding women, those taking certain medications.
Yeah.
It's essential to approach it with caution and under medical guidance.
Okay, so weighing the potential benefits against the risks is key.
Absolutely.
It sounds like there's no one-size-fits-all solution.
Exactly what works for one person may not work for another.
Right.
Finding the right approach might require some experimentation and patience.
Yeah.
Working closely with your healthcare team.
This has been incredibly informative. I'm feeling much more optimistic about the potential of these complementary approaches. Before we wrap up, I think it's important to touch on the latest research in emerging therapies for Behçet's.
Okay.
Let's dive into that in part 3. All right, so we've covered so much ground already, the symptoms, the causes, the treatments, both conventional and complementary. But now I want to look to the future.
Okay.
What does the latest research tell us about emerging therapies for Behçet's? Like, where is treatment headed?
Well, the research landscape is definitely evolving.
Okay.
And it's offering a lot of hope for people living with Behçet's.
That's great.
One of the most promising areas is the development of these targeted therapies.
Okay.
You know, we've already seen the impact of biologics like TNF inhibitors,
Right.
which really focus on specific inflammatory pathways. But now researchers are going even deeper.
So it's about getting even more precise with how we address those root causes.
Exactly. This precision medicine approach has the potential to create more effective treatments, and hopefully with fewer side effects.
Which is a win-win.
Definitely.
Can you give us some examples of these new targets?
Sure.
And how they might change things for people with Behçet's?
So one target that's generating a lot of buzz is a molecule called interleukin-1, or IL-1.
Yeah.
It plays a key role in inflammation. And blocking its activity has shown real promise in treating other autoimmune conditions.
Okay.
So clinical trials are now underway to evaluate how well IL-1 inhibitors work for Behçet's.
So it's still early days, but it sounds promising.
Yeah, for sure. Particularly for like eye inflammation and skin lesions.
What are some of the other targets that researchers are excited about?
Another area of focus is Janus kinase inhibitors, or JI inhibitors.
Okay, JF in there.
These medications work by blocking a specific signaling pathway that activates immune cells. So they're essentially calming down that overactive immune response that we see.
Oh, so it's kind of like hitting the brakes on the inflammation.
Exactly. And early studies suggest that JI inhibitors might be helpful in treating a wide range of Behçet's symptoms.
Like what kind of symptoms?
From those painful ulcers to skin lesions, even joint pain.
Wow, so it could really improve the quality of life for people with Behçet's.
For sure.
Are there any other advancements on the horizon?
Definitely.
Beyond new medications?
Researchers are also looking at new ways to diagnose and monitor the disease.
Okay.
There's a growing interest in using biomarkers.
Okay, biomarkers, what are those?
Those are specific molecules that are found in blood or other bodily fluids.
Okay.
And they can be used to detect Behçet's earlier and more accurately.
Oh, so it's like finding a fingerprint of the disease.
Yeah, exactly.
Before it even fully shows up.
That's a great way to put it. And these biomarkers could also help doctors track the progression of the disease and personalize treatment plans even more.
Leading to better outcomes.
Exactly.
It feels like we're moving towards a future of like personalized and proactive care for Behçet's.
Definitely.
It's really encouraging.
It is.
What else is happening in the research world?
Well, there's also a lot of interest in the gut microbiome.
Oh, the gut microbiome.
That community of bacteria that live in our intestines.
Right.
And emerging research suggests that imbalances in the gut microbiome could contribute to autoimmune diseases.
So our gut health could influence our risk of developing Behçet's.
It's possible, yeah.
Wow, that's fascinating.
It really is. This opens up a whole new avenue for potential interventions.
Like what?
Imagine being able to modulate the gut microbiome through diet probiotics or other therapies to prevent or even treat Behçet's.
That would be incredible.
Yeah, it's pretty amazing.
It's amazing to think about how interconnected our bodies are and how seemingly unrelated factors can have such a big impact on our health.
I completely agree. It really highlights the importance of taking a holistic approach
Right.
to understanding and managing this really complex disease.
Well, this deep dive has been incredibly insightful.
It has.
I feel so much more optimistic about the future of Behçet's treatment.
Me too. It's
Oh.
been a pleasure exploring this topic with you.
Likewise.
The progress we're seeing is truly remarkable. And I believe we're on a path towards a future where Behçet's is a manageable condition that doesn't define people's lives.
I think our listener is walking away from this deep dive
I hope so.
feeling empowered and informed. We've covered so much.
We really have.
The symptoms, the causes, the treatments, both conventional and complementary,
Yeah.
and even glimpsed into the future of Behçet's research.
It's been a fascinating journey.
And before we sign off, I'd like to leave you with a thought-provoking question. Based on what we've learned today, do you think the future of Behçet's treatment might lie in personalized approaches that combine conventional medicine with tailored lifestyle interventions? What unique combination would you create? Keep exploring, keep asking questions, and keep advocating for your health. Knowledge is power, and by staying informed and proactive, you can navigate this complex condition with confidence and hope. Thanks for joining us on this deep dive into Behçet's disease. We hope you found it valuable. And as always, stay curious.